not. I'm still chewing. Why would you do that to me? So today, we're using Almay. We like to call it Skip the Gym. And I think it's appropriate because there's no gym in the world that you can go to today.
That may be changing.
Yes, and we will be diving into that, I'm sure, on Newswire.
Wow, that was a nice segue in there.
That was, wasn't it?
Yes.
It's like I've done this a time or two.
Yes, you're kind of getting into the swing of things.
No, I'm not. I'm just kidding, but this one is a good little lipstick. You can buy it at Target. It has this cardboard on the outside, too, so it's kind of like eco-friendly. I mean, this part's plastic, but I like the name. You had to go
and ruin it.
What do you mean?
Eco-friendly. We are anti-eco-friendly.
But it's recyclable, and I appreciate things being recycled and reused.
Everything is recyclable.
I appreciate it being recycled and reused.
Everything is recyclable.
When you work with a frickin' hillbilly. Why do I even try? I don't know.
Starts every day at 5 o'clock. Live at 5. Live at 5 on Newswire and Facebook and YouTube. On a
Money Monday? Or are you going Manic Monday?
No, it's Money Monday. Things are opening up all across the board.
But is California opening up?
Slightly.
Where? Can we go out without wearing a mask? I've been doing it anyways, and the looks I've been getting, I probably shouldn't be saying it, but I can't. I forget it at home, and then I'm like, am I supposed to carry it in my pocket with me everywhere I go? It's bulky. It's big. It messes up my makeup. This is making me mad. I'm just saying.
Oh, man. I was going to say something, but I remember the first law of holes. So I wasn't going to dig myself into one.
Doesn't bug me, though. Now I want to know what you're going to say.
No, it's absolutely... Man, like I said, kick the freaking doors open. And...
What?
Oh, you're going to say something?
I don't even... No, because it's going to totally throw it. Carry on.
Kick the freaking doors open's what I've been saying.
Ow.
Yes.
Cramp.
On the... And it started. Well, Friday, Texas Governor Greg Abbott, outlined a plan to open up or start opening up this month, and further extending it. He would announce on the 27th if he was going to extend or what more measures he was going to open up on April 30th. So it was kind of calm a little bit during the weekend. I mean, the Trump press conference on Sunday was absolutely fabulous, and the reporters' questions, that livened things up. Dingbat Newsom was out there, renting practically all the Motel 6s with your tax dollars to give to the vagrants.
Yeah, what was up with that? I'm like, why is he standing there in front of a Motel 6? Like a party going on?
No. The party going on is, he's taking money out of your wallet and giving it to somebody else to live.
In there.
Yes. It's a party you're paying for, but you're not invited to.
Screw that, I'm going to go party.
On top of that, so we'll get into that a little bit later. We're going to have Dr. Kelly Victory on at the bottom of the hour. Man, on top of Georgia, South Carolina starting to bust this stuff open. Santa Cruz, California started opening their beaches to surfing. Ventura County is opening the beaches, the golf courses, and some small businesses are being allowed that were considered... Would you like your business or anything to be considered non-essential?
Of course not. Nobody would ever want to feel like they're
you talk about who's the ones that use the bad terms, these government dingbat officials. They're the ones that use all the negative, hold you down.
Like calling people dingbats and
stuff?
Yes,
or you are no longer essential, you are non-essential. We're going to have to do the obsolete man of the Twilight Zone. I mean, that thing is absolutely... apropos to what's going on. But no, they're opening up some small businesses. Even in Riverside County, they finally got a semblance of smarts going on. Tomorrow, I think it's starting tomorrow, golf courses in Riverside County will be open. It's a start. Now, talk about the stupid word social distancing, which I wish would go away. It's totally ignorant, in my opinion. But wouldn't golf courses be the epitome of social distancing? There's 10 people on 6,000 acres of land. And
maybe some people just don't want their balls touched and getting infected. Don't say that serious. I'm just saying. What if you grab someone else's balls and you're sick? And you're around each other. They go in the same area. Well, I can go on for a while and make it really. Anyways, I'm serious though. Maybe that was their thought behind it.
No, it was stupid. The whole thing is stupid.
Stop saying things are stupid. It sounds rude.
The filling of the started in San Clemente. Go look for the video, and it's like in the middle of the one in the San Clemente of the skate park. That was the first one. The idiots down there said, okay, well the kids were still skating in the skate park, which is like a pool, down in the skate park, yada yada yada. So we're going to fix that instead of just doing that. They filled it with 37 tons of sand.
I saw that. That made me so sad. You're wasting all this sand or time just to move all the sand for what?
Exactly.
For what?
Well, Venice had to copy the same principle. I've heard people hollering at me about, the kids are using the skate park, da-da-da-da-da. Well, yeah, because you know what? You're killing people. They're going, locking people up is going to shorten years of their lives, gives them more disease or anything else. This is what, after they filled it with sand, I got to applaud these guys that are doing this. This is what happened at the San Clemente skate park when they filled it with sand. Go ahead and roll the video of that.
Thank you, Ann, for my bracelet. I love it. Okay. I had to give her a shout out.
Yes. That they had when they filled the skate park with sand. This is the response some of the residents had with that, as I'm trying to vamp as the video comes up. As it's frozen in a perpetuity of that while I was trying. No, they rode some motorcyclists got out there and rode them on the deal on that.
There you go. Bring your dirt bike out.
Yes, they're working it out. They're going to ride motorcycles on that. That's some. Is that them pushing? Yeah, they're. I guess they're making the track of it on that. Where's it?
But look at these kids. They're out there
Right
cleaning
there
up.
we go. Here we go. As it's.
Yeah.
You can see the picture of the kid now as you're watching on the video as it's getting ready to roll. There's the kid riding the motorcycle.
He doesn't like you.
On the deal, yes. Yeah, for some reason the video's not playing. But they went and rode motorcycles. Looks like, like the kids one. There you go. Now we got it. There you go. They're running their motorcycles through the sand. They didn't even fill the damn thing up. I mean, yeah. This is why you don't put... This is why... If you keep electing the dingbat politicians and the yo-hos that they hire a staff that figures this stuff out, like, we'll fill it with sand, they can't skateboard on it. So the motorcyclists went and took it over, you brain surgeons, because they are getting people are just getting teed off. They were marching in their cars up at the state capitol. I don't know how the one went in Riverside today. I would have liked to have been... would have liked to have gone down to that one, but they, had to do you had to cover the press conferences here. But they were protesting up and down like they did in Michigan with their cars at the state capitol in Sacramento. People are saying we've had enough of this crap. It isn't. Now, this is the breaking news. We've done the South Carolina. Jacksonville, Florida. You see if you can find the picture of Jacksonville, Florida. Friday, they opened up Jacksonville, Florida. And it was mentioned at the Trump press conference. Trump said, or no, Dr. Birx mentioned it. Well, Florida's all different. It's breaking out down the south of Miami. Up in Jacksonville, there's no problem. Well, we don't have much of a problem with them opening up the beaches. They opened up the beaches. People flooded to the darn thing.
Yeah.
But yes, they're up and down. That's some Friday. And it was exactly what we've been saying. This is not monolithic. You don't need to be locking down the whole country or whole major portions of the state. Dr. Birx, this isn't Crazy Roy saying this stuff, the ditchbank Okie from Edgemont. Those of you that are heralding Dr. Fauci, and where the hell has he been? No Dr. Fauci today at the Trump press conference again. I think he's only been on there once or maybe twice in the last week. But anyway, that's what she said. Well, Jacksonville's not having any problems, so we don't have any problem with them opening them up. Duh! That's what we've been saying. There's just no reason to be locking this down. Yes, elderly people in nursing homes have a predisposition to getting this stuff. Yes, we need to protect them. We need to put measures in place for those. New York City, the cesspool hellhole of high density in America of that, yes, just lock that place down, put a lock on it, and tell them if you want to live like rats in a cage, then have New York City to yourself. Don't bother the rest of us, or don't project your cesspool of life over there to the rest of America. Ain't happening.
See, you're in a good mood today.
Yes, because people are finally standing up to this crap. We're finally starting to.
But you sound mad. You should be happy.
I am happy.
You happy?
We're tearing down the walls of stupidity that were being built over this stuff. We're starting to. The Dr. Fauci's that were claiming all this Armageddon pandemic, worse than the Spanish flu, worse than the Black Plague. We're all going to die.
But maybe they thought it would be. I mean, not everybody in this scenario is stupid. Say it.
Not everybody is, because I would not include myself in the stupidity because I've had.
You never would. I mean, that's just you being you. But I think that there was some legitimate fear there. I mean, I think somebody obviously down the line was given the wrong information. And with what information was given in the beginning, it was scary. I don't blame them for how they acted. They were maybe somewhere out there, someone was trying to save lives. So thank you for whoever that might have been. But lives have been saved. So let's open back up my world so I can live
at the expense, as we're going to cover later on with Kelly Victory, maybe at a larger expense or a more death rate or more. Look at how much problems this has caused across society of people locking people up and going crazy and stuff. And like you say, we talked about it, about the fresh air and stuff, and CDC recommendations.
But you know what? Now the air is so much cleaner because people haven't been driving and stuff like that. So I mean, that's a positive way to look at it. Let's look at the bright side of stuff.
You know how much a barrel of oil is today?
I have no idea.
Negative. They're actually paying you to take a barrel of oil. It is actually worth.
Wow.
It is actually anybody. The price of a barrel of oil went into negative territory.
Why? Because it's going to go
bad? Because there's so much of it sitting there. Nobody's using. That goes to show you the biggest user of energy is the United States of America. We produce it and all this stuff, but we produce so much of it now that in our country, which they said in the 70s and in the 80s and 90s and 2000, 2010, America would never be a net exporter of energy, which was a total frickin' lie, because we're doing it now and we did it in 2 frickin' years.
Okay, don't go on that rant. Stay focused on where we were going, which I don't remember. But anyways, I think it's, I mean...
And it is. Look at all this.
I think people are going to learn how to wash their hands now after all this. That's a plus side. Maybe with the next year when the flu does start going around, I want to see how people react. Maybe next year people will start wearing masks when they're sick and they'll start washing their hands more. And maybe this will help create a cleaner environment for everybody and for my children to grow up in.
I would say so.
I appreciate that part.
And I do. When you're sick, don't go to work. When your kids are sick, don't send them to school.
Define sick though and sending kids to school.
Wash your. See, you're already canceling the common sense.
But the common cold, I believe that people need to get. I want to get sick. I mean, I think people.
They're talking about herd immunity of this stuff of that, and that's how we're going to beat this stuff. Again, if we get enough people immune to it, it's went through the system, and that's what we're going to talk about in a second. What you got to guard against is the herd mentality. The herd mentality of the Dr. Fauci's and the WHO and the Chinese and all these other yahoos that have been saying, and Gavin Newsom and Cuomo and all that other stuff, have been saying, oh, this millions of deaths, 100,000, million just in freaking California is what Gavin Newsom said. Bull hooky, you're a piece of shit lying.
Well, you already went that far.
Yes.
Well, why are you not going to finish the sentence?
And
maybe he was wrongly informed.
no.
Calm down.
No. No, he is not, because he's continuing to do it. He brought up the race. Now COVID-19 is a racist virus. Go watch the California press conference of Gavin Newsom and his, whatever that doctor he put up there, and said, well, the reason people with a darker brown of skin tone have this is because of racism. And then Newsom had to go on with the systemic stuff and all that other stuff. This is what kind of bull crap they're feeding you. And if you, the people of California, elect not only Gavin Newsom on down, these yo-hos that keep feeding you this bull crap of what's going on, is that because Cuomo said it in his press conference. The reason is because they're overrepresented in the service industries, in the industries of healthcare and stuff, and they were probably more exposed to it. It has nothing to do with DNA genetics or anything else. So 2 hours later, he's spouting this kind of crap to the people of California, all 40 million of them, trying to get him to buy that. What they want to do is conquer and divide. They want to put you in a class and say, this person hates you versus that, and that's how they control you. They control you with the words of systemic racism, and this is the boogeyman, and the straight white male has got your thumb on you, got his thumb on you, and that's how they try to control you with this false narrative of what's going on. And if you don't resist against that, you will be under their control, because this is in the LA Times, and we'll go into it more with Dr. Kelly Victory on that. The USC study, breaking news, just came out this afternoon.
I'll give you a drum roll.
Thank you.
I think I didn't have to ask. Making progress, people.
This translates to, they did a study with the antibodies of that. Mind you, in March, they said we only had 8,000 cases of coronavirus in LA County. This is in the new USC study that's tested for the antibodies in LA County. The new study, this translates to roughly 221,000 to 442,000 adults who have recovered from the infection, referring to COVID-19. According to the researchers conducting the study, even though the county had reported fewer than 8,000 cases at the time. There is 400 deaths in LA County right now. If they have had 200,000 to 400,000 people in LA County have already had the virus, and only 400 have died, that is a death rate of 0.02 or 0.01%. That's 0.2 or 1/10 of 1%, which is about the average of what dies in America every year of the flu, any flu that comes along. So, and they're talking about closing LA down for the rest of the freaking year, Garcetti, the mayor is?
Why do you have a whiteboard? Are we playing Pictionary?
Yes.
I love Pictionary. Don't make me do math, please.
Yes.
Why?
There you go. So you can see it. 0.2 of a percent, 0.1% if this USC, University of Southern California, study is correct, that we've already had this. We've had the Stanford study, which almost backs this up. You have a study in Massachusetts that said 30% of the people there, looks like they already have the antibodies to that. Uh-oh. Probably against my better judgment.
No, You're fine.
that I handed that.
Yeah.
But no, there you go. There is the studies. But they've been saying, 1 million people could have died on this. And they're going to say, because of social distancing. Why didn't people die? Why wasn't there this big death rate of people? Or do we know? Do we know the count? Do we know that the counts that they're giving us are accurate, or why and what and what? I should have gave you the red one.
Okay. I don't know where you're.
On the
I think it fell.
But no, they're
I was hoping it'd hit you.
There it is. Breaking news of the L.A. County study that says that. Now, who's been telling you this? We've been reporting it on the show. Experts like Dr. Kelly Victory we've had on telling you this. This is not the on the scale of the bubonic plague, Spanish flu, even the 68 Hong Kong flu, or even that. It might not even, in 2017, in 2017-18, we had 60,000 people. That was our highest year in the decade, probably up until this year. I think 66,000 people died of the common flu. We averaged 40 some odd thousand every year for the past decade died from the common flu. Trump is even saying, well, we might not even hit 60,000 this year with coronavirus. Now, that isn't taking account of the flu, but this thing is not way off the scale. It's not something that we have to be concerned about. Trump said on the press conference today. Cuomo said on the press conference today. Newsom said on the press conference today. We're on the down. It looks like we're plateauing and on the downhill curve on all this stuff. So there is no reason to keep these draconian lockdown, idiotic measures going back and forth, or scaring the people half to death, or all of this, and creating an angst amongst our fellow man that we're now afraid to get within 6 feet of each other because you're going to kill your mom or some sort of thing. This is what I'm happy about. It seems like we are finally busting through that paradigm of fear that they've been using to control the vast majority of you, and you're saying, not no, but hell no. And I want to give you a lot of props because you were probably one of the,
Me?
Yes.
What?
Because you would be of the profile, if you were profiling, or statistically, probably in the statistic that would have been fear. Oh God, I got to lock down of that. But I mean, quickly you came to, after looking at the real information or what was out there, you said, you know what? These people are feeding me a line of blank.
Right. Carry on.
I think I've released
I love this whiteboard.
I think I've released a monster now.
You did.
On the,
Anyways.
Oh, yeah. Well, what do you got that over here? Give me that.
I know. It's perfect.
Now,
who wants to play Hangman? No, I'm just kidding. Alan writes in, and I'm guessing this was for you because, anyways. He put, as I'm dropping all my stuff. Can you comment on the White House's coronavirus briefing? Trump said that they would provide enough testing for the states, and it is your responsibility to do your own testing. So states fired back and said testing is not enough and we need federal assistance. But yet Trump told everyone how good as a team you're doing and pressure most of the states to slowly open. I think Trump wanted all the credit to himself, but don't want to take the blame for whatever has happened.
Who was that again?
Alan.
Thank you, Alan. Because now you've given me another 5 or 10 minute rant on what I was going to get
Alan,
to.
me and you are no longer friends. I don't know you, but I will never know you. No, I'm just kidding. Just kidding, Alan. Great comment. And Roy is going to be nice and not biased.
And this is the reason why we post on Newswire the complete and whole press conferences of NYC way governors, which are the Siamese twins, Newsom and Cuomo and then you have the opposite side of Trump. So Cuomo at his press conference today is whining and crying. Federal government's got to. The federal government use the red. I think it shows up better.
Okay.
We'll see. Try the red. Whining and crying. We're broke in New York. You know they spend $9,000 per capita on their general fund budget versus $5,300 in California, and we're broke too. It isn't how much money you give. It's a lack of. It's a spending problem, not a revenue problem. But he said we're broke. We spent all our money on building subways and trashy apartments and making our people sick and living them in a hellhole of an environment. And we're so proud of that we spend all the money giving it to the homeless, making you ride subways, creating an environment where the coronavirus will kill you. He didn't say that, but that's my analysis of it. But on top of that, he said, well, the federal government's got to come in and help us and provide the money for testing because we're broke. Well, why don't you have some money stashed in the corner like any other person should have? So when you have these problems, you can deal with them. That you don't have to call the federal government for testing. You've got your own mobility, your own hospitals to come in. You don't have to say, well, we can't, because you spent all the money making your citizens' life a hellhole. And now you want the federal government, which is broke because we do the same stupid thing and have done it for decades. So we either got to buy our money, from the Chinese? Or print it, which devalues your money. So, again, the are you thanking her for making me so you're hearing this rant? Or
So I didn't think of that.
See how I can twist that around?
Yeah,
so
great.
Again, so you were asking, well, how did we get in this situation where we're dependent on China for ventilators and masks and everything else? Well, it's because of the stupid policies you did. And you were in the HUD administration with Bill Clinton that was running all this stuff. You know exactly what it is. So quit lying to the people. Tell them I did this to you, and now I'm laughing at you, you stupid suckers.
And, Ellen, there's your answer. I hope you... commenting.
And they're not even testing. They should be testing for the antibodies, like the USC study, like the Stanford study, like the Massachusetts study. Let's find out how close we are to herd immunity. That's what we really want to know, because you could take a COVID-19 test and walk out of the facility and with a negative result, and you could walk out the door. And somebody with COVID-19 could cough on you, and you could get the disease 10 seconds later, and you wouldn't know it unless you got retested. All that does is say, at that particular moment, at that particular time, you do not have COVID-19. If they test you for the antibodies of it, that will tell you if you have already had it, you are immune, as they're pretty much thinking in most viruses. Once you get it, you become immune to it. You cannot catch it again. That's what they call herd immunity. And that's how we get rid of most viruses, either by vaccine or you getting it, exposed to it. Your system, your natural immune system, builds a resistance to it, and it will no longer affect you. That's what we should be working to. We should be working to solutions that will work.
It's a coffee cup.
Yes.
Wow. You can take this away from me.
And this is why...
Steven writes in, doesn't China have all the precious minerals that we rely on?
No, opposite. Do you know California is sitting on reserves of some practically every natural mineral in the world? You could run and manufacture everything in the world. You could supply enough stuff with the natural resources of California to run every country of the 7 billion people in the world.
She told me to write it bigger and hold it up longer because she's too old and she can't read it.
I think she won the thank you one.
No, my mom said
Oh,
that.
yeah, that's your... Oh, okay. But no, we can run the whole world on that. Every natural resource, we have the most productive... That's why they call it most productive farmland in the world, us in Mexico. That's why they call it Silicon Valley. All those rare little chips and stuff come from up there. Da 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 da. We have the resources in California to run the world. We could feed the world. We could make every manufacturing product in the world right in the great state of California. China gets a lot of that stuff from us.
Hi, Sean.
Hey, how's everybody doing? Hello, Stephanie.
Hi. Help me. He's on a rant.
You can't write fast enough.
Did you guys have a fun weekend? What'd you all do? Did you go out and party or?
Oh yeah, we we were at the
1 minute.
Are you trying to get
sucks,
us to incriminate ourselves, saying that we're defying the orders? Like a lot of people are, like the kids on the motorcycles that went after they filled the skate park in San Clemente with sand, and they went in there with motorcycles, started riding on it, saying, "You know what? Blank you guys, you idiots that run the government, and you staffers, you government employees, they can't figure out." Quit trying to hose the people over. Open stuff up. Let's be realistic about this stuff.
Steven writes in, and I'm probably not going to like you after reading this.
30
we have
seconds.
the largest
30
oil
seconds.
reserves in the world, but yet we buy it from other countries.
Correct, Steven.
That's it?
Yes.
Oh, okay. I thought I was going to go on a rant.
Well, no, I've ranted about that for many times on this show. The biggest oil reserves in the entire world are sitting right under the state of California, and we can't.
All right, everyone.
They will not
Here
allow
we
you to drill them.
90am.com and download your free phone app today. IE Newswire Daily is on the air.
The following is a paid program. Views and claims expressed are those of the program producer and are not endorsed by the station. Opinions expressed not necessarily the rate.
On every Monday through Friday at 5:30 all across the airways on the Mighty Med 1490 KMAT on a Money Monday. And it's a big Money Monday. It's breaking out across all across the country. Beaches are opening from Santa Cruz, California to Jacksonville, Florida. Ventura County is opening up, starting to open up their beaches, golf courses, and some small businesses. Even in Riverside County, where they've been telling you, if you go outside, you may kill your mother. They're opening up golf courses starting tomorrow, I believe. Georgia's opening up. Now, South Carolina's opening up. We're getting new tests. We're finding out there may be herd immunity out there. The walls of stupidity are finally starting to be torn down on this whole coronavirus issue. The scare tactics, the lies, the fear-mongering is all starting to get exposed on this. The people have said we've had enough. They are marching from Michigan to California at state capitals, city councils, mayors. They were down there at the mayor's house yesterday in Encinitas, California, saying, what in the hell is going on here? Finally, people are waking up and saying not no, but hell no on this whole deal.
Carla writes in, I want more testing to be available and people that are protesting to sign a waiver, period.
And we need more antibody testing to figure this stuff out. But it is our privilege to bring on our next guest. And there's certain people that you find or you listen to or you read what they're saying, and you just know, or you just get that little, that little voice in the back of your head says, this person really knows what they're talking about. You can trust them because they're not, what they're saying first makes sense. And if it does make sense and they put it in a very simple and succinct way, I think it's Osman's Razor or something like that. Go look that up on a start page or something, not that other device. But you find these people out there that are doing that, and they just make sense, and they can explain it simply. And if it does that, they're probably 98.7% of the time, you're probably going to find that's the people you need to follow. So we've had her on for the past couple of weeks or so, giving you facts, not fear, on COVID-19. she's been laying out the case, and I know she's been taking a lot of flack for it.
Yes.
On this stuff, but she has stuck to her guns, held her ground, not wavered, giving you facts, not fear, and each and every study that's just coming out and just breaking today seems to be confirming or giving more evidence to everything Dr. Kelly Victory has been saying has been spot on. Welcome to the show with Stephanie and Roy on iNewsWire Daily, Dr. Kelly Victory.
Hey, great to be back with you guys. Thanks for having me.
Always.
I'm sure you've seen the new USC study that just came out on LA County, and that's why I kind of introed that in, because you have been saying this virus has probably spread a lot more than they've had. The numbers they have been giving you have been based off of flawed analysis data or all kinds of things. Why have they been doing it? They're coming up with a mortality rate that was more in line of what you said would probably be in this. But along with that and many other things, but I'll let you take it away and explain what's just been happening here lately on all things COVID-19.
Well, thanks, Roy. As you said, a study just came out today from LA County. Relatively small studies, by the way. They aren't using huge numbers of patients or people. What they are doing, and it's not just in LA, because a study came out last week from Santa Clara, California, as well as from Chicago, and one coming out of northern Massachusetts, all of which are looking at sort of random sampling of people, pedestrians, who have no symptoms whatsoever, who are well, have nary a complaint of being ill, and they're testing those people finally for antibodies, the antibodies for COVID-19, and finding out, as you said, as I had predicted and suggested from the very beginning was going to be the case, that a huge percentage of people, way more than they had initially predicted, already have antibodies. And what that means is that those people were already exposed to the virus, had it, but their symptoms were either so minimal or non-existent that it really didn't cause them any, never mind, and they're already immune to COVID-19. Now, that's a very good thing. The fact that a huge percentage of the population has likely been exposed, I've said from the beginning, is a very good thing, because with that, it not only brings immunity, but it also means that the numbers you've been hearing from the beginning, these dire predictions about, mortality rates, are way off. They found in the study out of LA that probably 30 to 50 times more people have been exposed than they first predicted. In Santa Clara, they said 50 to 85 times more people had the disease than they had initially thought. And what that means is that the mortality rate is 50 to 85 times lower than what they've been saying. And as you said, what that means in real numbers is that the mortality rate from COVID-19 is likely, when this thing all plays out, is likely to be on par with sort of a bad influenza season, which is about 0.1% mortality rate.
So we heard the numbers from Trump. We've heard them from Gavin Newsom. Gavin Newsom said when he issued the state stay-at-home order, 1 million people could die from COVID-19. Well, yeah, 1 million people could die from the Hale-Bopp comet crashing into the California. We could make all sorts of wild predictions. There was never any real evidence I ever seen that supported coming to this conclusion of that. Maybe there was, but it just didn't make any, when they were running these wild numbers of that, it just didn't make any sense of that to me. And that's why I started on, looking at this. I've seen some of your tweets on the stuff and reading them and others of doing this. The few that were out there saying, wait a minute, take a look at what's really going on this stuff.
Right. And again, I've said this over and over, but I will reiterate it tonight, that I have never said and would never say that this virus isn't real. It's a very real entity, and it causes significant illness in some people. just like influenza does, or like SARS did, or like the swine flu did. There are lots of viruses out there that can cause significant disease in certain populations. The issue with this one is that we've known really from the beginning that the vast majority of people are not going to develop significant disease. Somewhere upwards of 85% of people are going to have very mild illness, if any symptoms at all. So you're really looking at who are those people who are at significant risk, those people in that, over 65 category with underlying health conditions, whether that's asthma or emphysema, or people who might be immunocompromised because, say, they're on chemotherapy. So there are groups of people, pockets of people who are at significant risk, but they clearly were wildly overestimating the number of people who are going to become profoundly ill, and certainly the number who would die. As you'll recall, back at the beginning, the models have been just awful from the beginning. The very first one that kind of started the panic fest, as I call it, was the study that came out of the Imperial College of London, and Neil Ferguson, who authored that study, suggested that 500,000 people in the UK alone were going to die, and upwards of 2.4 million people in the United States would die. Now, fortunately, we haven't gotten anywhere near that. Still, obviously, any death, we don't want to see people die from this at all. We've had somewhere around 43,000 deaths in the United States so far. That puts it right about just a little bit less than a really bad influenza season. Right now, the CDC is predicting that upwards of 56,000 Americans have died from influenza. So 56,000 from influenza, about 43,000 from COVID. Again, no death. We mourn all of these individual lives and feel for their families and loved ones, but we don't routinely shut down the economy, bring everything to a screeching halt, and they have the devastating impact on people just because of those things. It's really, I get irritated when I hear people say, "Oh, I know it's a lot of inconvenience to stay." This isn't an inconvenience. Costing people their livelihood, costing people their homes, their businesses, their life savings, their ability to do any number of things. That's not just an inconvenience. It's a lot more than that, and I don't think we can overestimate the toll that is taking on people. So it's not just the cost of the virus itself, but it's what this incredible overreach and really overreaction, the impact of that has been just devastating.
We have a comment that I think is actually a really great one. Other people agree as well on our Facebook live stream. Stephen writes in, I have heard that some people who haven't had good hygiene are more immune to the virus. I haven't heard any stats on homeless environment. Do you have any information on that?
No, and it's a great question, Stephen, because you would really think that the homeless people would be dropping like flies, right? Because they have generally poor underlying health, or lots of them have underlying health conditions. They don't have ready access to the same kind of medical care, and they tend to live in relatively close contact with lots of others.
Right.
Yet we're not seeing huge outbreaks in the homeless population at all. And it really begs the question about, number one, how well social distancing does to actually stem the spread of a virus like this one. And also, again, brings back the question of how many of those people already have immunity because they were exposed, if not to COVID-19, to something similar. And I think that's what you're getting at when you say, people have poor hygiene. I think what it really is that people who have been exposed to many, many other viruses or bugs tend to build up good immunity. It's a reason, frankly, why kindergarten teachers and doctors aren't sick all the time, because you get exposed to lots of little runny noses as a kindergarten teacher, and you become really quite immune to a lot of those viruses that would otherwise take people down. So we are not seeing a huge population of homeless folks getting in the hospital, just like we're not seeing gobs of grocery store employees who you'd think, gosh, they see hundreds, thousands of people a day, but they're not all dropping like flies.
Exactly.
There you go. And it came up at the Trump press conference Friday. Jacksonville, Florida, which is upstate of Florida, a long ways from Miami, opened up the beaches and everybody flocked to the beaches. So the question at the press conference, and Dr. Burks answered is, well, are you okay with opening up Florida, Jacksonville beaches and that? And she said, yes, because Jacksonville, Florida is a long ways away. They weren't having a problem. It was down in the Miami-Dade area, south of the deal, which I'm almost jumping out of my seat thinking this is what a lot of us have been saying. Why are you treating one area like projecting the New York City model across the whole country? Why are you not? Yes, we know we have a problem in nursing home, the elderly, people that underlying conditions. Yes, they need to be protected, but the rest of the population does that. And the homeless thing is, that's what is, I think there's been like 3 deaths or 2 in LA of the 50,000 homeless in there. Why wouldn't it be running rampant through there? You would think that would be ripe for conditions for that doing. And all this evidence seems to suggest that. So, again, they're kind of coming back to the point of, yeah, we do need to treat areas as individual areas and not this one monolithic deal and lock down everybody and then we'll try and figure it out.
Carla writes in, which this kind of goes with yours too, but many people are not being tested. My stepdaughter and her boyfriend all had the symptoms and no test was done. They were just told go home and quarantine, so they are not being counted, but no test was given.
And that is spot on, Stephanie. That is precisely what I've been saying from the beginning. We are under testing, and therefore the numbers are wildly off. It's sort of, if you say, well, 10 people have coronavirus and one of them died, well, 1 out of 10 is 10% mortality rate. But that's because you only tested 10 people. If you tested 1,000 people, you still have that one person who died, but now it's 1 person out of 1,000. And you find out that actually all those people had it. So your caller is exactly right. We are wildly under testing, and in fact, the mandates from the state medical boards. I have a medical license in multiple states, and every single medical board sent out guidelines telling us who we should and shouldn't test. And we were specifically told not to test people like her daughter or son-in-law, because they're young, healthy people. So we were told, just don't test those folks. Save the tests because there aren't enough for the people we really need in the hospital. But what that resulted in was wildly underestimating how many people really had this thing. And if we now can finally get widespread antibody testing, we'll be able to prove it. And that's what you're seeing in the study that you just cited at the beginning, Roy, coming out of LA County, and the one that I'm talking about from Santa Clara from last week. Once we start really testing, we'll know, because I guarantee I had it back in the early part of the year as well. A number of my close friends were very ill with an upper respiratory virus, and most people didn't ever go and get medical care. We just treated ourselves symptomatically, and I suspect that all of us will find out that we actually have COVID-19 antibodies.
That goes to one thing, a question I had, and it struck me, and I've been saying it today, but, COVID-19, if you have symptoms or whatever of that is important to get tested or whatever on that. But, I mean, to me, it would seem like the antibody testing is much more important, or much more, would give you much more information, because then you would know how far we are along in the herd immunity. Their modeling would be much more believable and probably accurate, instead of 50, 80, 10, 92 times off all the time. And then we would all, I think, have a much more comfort level if this was happening. Correct me if I'm wrong.
No, I think that's exactly right. And unfortunately, had we not had this overreaction of epic proportions, I mean, this will go down in history as one of the greatest public health overreactions ever. But had we not had that, frankly, Roy, we wouldn't even need the antibody testing, because normally we have outbreaks of viral illnesses. Had this not been identified as a novel virus, no one really would have batted an eye. They just would have said, wow, we're having a really bad flu year in New York City. Or Seattle just had a bad flu outbreak in a nursing home. It's only because we were able to identify this because of the relationship, frankly, to a geopolitical foe, namely China, and some things that I believe were fundamentally highly political in motivation, that we've ended up where we are right now. And the only way, unfortunately, to get themselves out of the corner that we've been painted into, is to now say, okay, fine, we'll do widespread antibody testing and prove that this is not an ongoing serious threat to the vast majority of people. Now, will you still have people who are at risk because they're in those risk categories? Absolutely. And we can do a lot to protect those people. But let's review that the concept of quarantine is meant to take people who are ill with a communicable disease and isolate those people who are ill, and occasionally isolate or protect people who are at significant risk. Locking up all the healthy people and making them prove that they're well enough to come out isn't quarantine. That's tyranny. So let's keep those apart. And that is not quarantine. Locking up healthy people and saying you have to prove that you're not a leper and you can come back outside and play is insanity.
Yeah.
I've been saying that. I mean,
and how are you going to prove that?
Yeah.
Like, what is their thought?
You would only be able to prove it by an antibody test. And so that now they're saying that either, the talk is because they've got to get themselves out of this corner they've painted themselves into. So now they're saying, well, either you need to prove that you've got antibodies, or you're going to have to take this vaccine that they're, trying to create. And that's going to be your ticket out, of jail. And that is not a sustainable model for getting the country back to work.
To go back to your vaccine comment, Mark writes in, and we have so many good comments and I can't read them all, I'm really bummed, but Mark writes in, I never did get the flu shot, but I know many people my age that did and were sick for weeks. What is the coronavirus vaccine going to do?
Well, I'll say right up front, in general, I'm a huge vaccine proponent. I'm talking about vaccines for things that are highly stable, like chickenpox, measles, polio, those things that you get vaccinated and you're good for life because they don't mutate and the vaccines are 99.8% effective. When you talk about vaccines for influenza, they are wildly variable because those viruses mutate every year. And so we're making a vaccine based on the flu outbreak from the year before. So it's kind of the CDC's best guess, if you will. And it's going to be the same thing with coronavirus. Of all things, coronaviruses are viruses that are extraordinarily savvy at mutating. They change very quickly. So the idea that we are going to launch a coronavirus vaccine that is going to be any more reliable than an annual influenza vaccine, and those influenza on a good year might cover somewhere around 60% of the bugs that are out there. In a bad year, it can be as lousy as 25%. And I think that's probably what you're going to look at with coronavirus. If I was saying to a colleague the other day, think about, every year we hear about outbreaks on cruise ships of norovirus, right? Where everybody gets sick and vomits and has diarrhea and it destroys the entire cruise. Ever wonder why no one's getting a vaccine against norovirus? Because there isn't one.
Yes.
Okay? Not all viruses are amenable to making a stable, really highly effective vaccine. So it's not that I'm anti-vaccine at all. I am pro-vaccine. Get your dang kids vaccinated. What I'm saying is that for this particular virus, the idea that that's what we're going to hang our hat on, that's going to be our the brass ring, that we got to get that dang virus so we can get back to work, is absurd. I think most people will find out a lot more of the public has immunity already. We are having very hopeful treatments with a number of different medications that we can talk about. But the idea of hanging on for a vaccine and hoping that that's going to be our savior, I think, is really unwise.
It is, and that's a great advice, and kind of my position. Not all vaccines are bad. There are plenty of good ones, like you say, chicken pox, measles. But some of these ones on viruses, at least for me, no way I can stay
Definitely.
away
I get
from.
my kids all their vaccinations. I mean, I keep up to date for that for sure. But something like this, no way in hell is that entering my child's body. And Mark writes in a great comment, and I bet they're going to try to put it in kids before they go back to school. My kids will now be homeschooled.
Well, they are. They have talked about that, whether or not they would make it a requirement for kids to attend school. I would certainly hope not. It doesn't, in my view, make any more sense than vaccinating kids against influenza, which we don't do either. And frankly, influenza actually can target and make children very sick. And children die. We've had 170 deaths from influenza this year. So kids die. More children die by far from influenza than from COVID-19. So vaccinating children for COVID-19 to me does not make sense. And I certainly hope that they would not try to go down that road. I think it would be very dangerous.
Thanks for being on and giving us the facts, not fear on this stuff, Kelly Victory. We'll do it again later on this week.
Sounds great.
Kelly.
Take care.
I love her.
Yes.
You know what? Mark writes in, and I don't have the comment because it goes so fast.
Yes.
But he got to the point, basically, he was saying, why haven't the healthcare workers at the front line been recognized, such as those that were in that shooting in Vegas or just anybody else that loses their life? So I think he has a great point on that. And I want to thank every healthcare worker out there that are putting their lives at risk.
Well, if you in the Riverside County Health Department, we ran that they did recognize, they have been recognizing the healthcare workers.
Good.
So we have posted. Go look at the post on IE Newswire on the Riverside County Health ones. You will find all last week. I don't know this week. All last week they were giving praise to the to those. So yes, we do air that stuff on.
See, I knew that. I just wanted to set you the platform.
Thank you.
Only here will you see that kind of stuff.
Of that, thank you.
So make sure you pay attention.
Yes.
And
listen
then
to Stephanie.
Yep. Stephen also writes in, how come all the celebrities have had no symptoms but were able to go and get tested? Money talks. You got enough money. You got the star factor.
We have had a couple of them though. Joe Diffie and John Prine and a couple others have died of coronavirus. What? Some drama actor in New York had his leg amputated due to complications of it. So they have been. It has been affecting that community too. So, but I understand what you're talking about. And we'll bring that topic up. That's a great topic though for discussion on that. Had a fun show today. Got a lot of stuff. Things are looking up. Finally, the majority, or maybe a majority, are saying not no, but hell no over all this stuff. We'll get back to not only reality, but a little bit of sanity. Be a
man. I think you're supposed to say it. Come on.
You cracked it, Be a man. Stop the band.
There we go.
We got it. We're gone.